To matters COVID-19 now, and Kenya has now surpassed the 5,000 corona infection mark after 254 new cases were reported in 24 hours. The positive cases now stands at 5,206, with Nairobi leading with 127 new cases. The new numbers are now forcing the Ministry of Health to emphasize on the need for home-based care. But even as the country grapples with the COVID-19 challenges, health workers are now threatening to paralyze provision of medical services if their quest for a health service commission is not heeded.
COVID-19 updates for more than 3 months have oscillated on numbers, mainly around Nairobi and Mombasa. Government now says Kenyans will have to learn to nurse their sick from home.
The positive cases that we are now reporting, as you all know, are a result of community transmission. And we are aware now that the disease is firmly within our urban and rural settings.
A total of 40 out of 47 counties, or 87% of all counties, know what COVID-19 is. And it appears that home-based care is now inevitable. Numbers that until Wednesday had not been in public domain show that out of 2,484 samples tested in Nairobi, 127 tested positive. In Mombasa, 636 samples yielded 36 positive cases. In Migori, out of 119 tested, 29 were positive, and in Kajiado, from 147 samples, 22 tested positive. In a nutshell, for every 100 people or samples tested in Nairobi, 5 turned positive. Mombasa, 6, Migori, 24, and in Kajiado, 15.
Especially in Mombasa, in the early stages, we recorded a number of home-based deaths, but because of intensified interventions and behavior change communication led by the Mombasa team, we are recording fewer and fewer community-based deaths.
And we've been able to look at this and define that Mombasa has an attack rate of about 107, whereas Nairobi has about an attack rate of 55. The risk of you getting COVID-19 is higher in Mombasa compared to Nairobi counties. And again, we're working to ensure that we are actually able to define risk per county.
Kenya has lost 2 more people, bringing the death toll to 130. Another 41 have recovered. The total recoveries are 1,823.
Solidarity forever.
Meanwhile, healthcare workers say they will cripple health services throughout Kenya should their efforts to have a health service commission not bear fruits.
Do what is right, and we shall stick to working. If you do what is wrong, and you don't pay us, then we will not work. It's that simple.
In Naivasha draft, then in Bomas draft, they removed it. And this time what we are saying, we will not allow the same mistake to happen.
So as health workers, we are not scared. If it goes to Parliament, we know it will be passed. If it goes to the people will vote for it.
Kenya's soft healthcare underbelly is currently getting tested under COVID-19 conditions, coming at a time that continentally, South Africa on Tuesday became the first African nation to lose more than 100 people to COVID-19 in a single day. Mark Namaswa, KTN.